Good afternoon, everyone. Welcome to the fourth day of Caraconference 2023, brought to you by Caracol, which is Greater Cincinnati AIDS Service organization devoted to positively changing lives in the fight against HIV/AIDS. My name is Suzanne Bachmeyer. I'm the Director of Prevention here at Caracol. Today, we have a panel discussion titled What the Community Wants, HIV Self-Testing, and that will be moderated by Caracol's own fabulous Jamar Jackson.
Hello, good afternoon. My name is Jamar Jackson. I am a health educator at Caracol. I am in my second year here. This is a pleasure because it is my second year to be able to moderate such a wonderful panel for our CARE conference. We will be discussing today the importance and the reason for at-home test kits, self-testing. And we have a wonderful panel of individuals, and I would like to introduce them now. First up, we have Nathaniel Holly.
Hi, everyone. My name is Nathaniel Holly. I am the CEO and founder of the Freelux Project, based here in Dallas, Texas. One of our first programs was HIV self-test program that we opened up nationally. I've been doing advocacy for about 12 years between Ryan White and other consulting gigs. But yeah, I'm glad to be here and happy to talk about HIV self-testing, which is a great tool for many communities.
Thank you so much. And next, we have Katie Rutherford.
Hi, everybody. Sorry about that. My name is Katie Rutherford. My pronouns are she, her. I'm the executive director of Franny Peabody Center in Portland, Maine. We provide HIV case management services, HIV and hepatitis C testing and linkage to care, and we administer Maine's HOPA grants, so housing support for people living with HIV and AIDS. I'm happy to be here. Thanks, everybody.
Thank you. And last but not least, we have Alexa Muchler.
Hey everyone, my name is Alexa Muchler. I'm the Director of Programs for Florida Harm Reduction Collective. We are a statewide nonprofit that aims to reduce the harms for people who are actively using drugs, obviously including HIV. Our HIV self-testing program was actually one of the first grants we ever won and has continued to this day, and we still have it through the CDC Foundation. So I'm really excited to be here talking about using HIV to help people who inject drugs.
Thank you guys so much for those introductions. I'm very excited to talk with you today about your self-testing at-home HIV program. So to start out, I will give the first question, and it's generally, what made you move to at-home testing kits, and how has it been received by the communities that you serve?
I can start with this question. Our organization, we started kind of around stigma reduction. So when we would host events, we would have HIV self-testing. We would have HIV testing on site, or we would get like a mobile unit to come in. And what we found is that a lot of people wouldn't utilize the mobile units when we would have these events or when we would offer testing on site. And so when the option came in to provide at-home tests, we did some research and some small focus groups just in the community and realized that there was a huge need and a demand for more anonymity and more privacy with how people receive their care, and at the very least with how they access their care. And so when we started our program, we didn't know how it would be received, but overall, people want access. They want free, of course, because healthcare should be free, especially as you take care of yourself. But they wanted the ease and the access and the privacy to be able to do it when and where they wanted to.
Yeah, oh, go ahead, Katie. I saw you just unmuted.
No, go ahead. I'll go after you.
Okay. Yeah, I mean, I love this question. It gives me a chance to talk about our CAB. We are we have oversight from a community advisory board as our organization. And that community advisory board is made up of everyone on the panel has experience, or everyone on the CAB, excuse me, has experience living with drug use. And they came to us and said, this is something that we're seeing out in the field when we do outreach in the field. People who are using drugs, especially unhoused people who are using drugs, are wanting at-home HIV kits for the same reason that Nathaniel was talking about, for the anonymity. There's less stigma associated with it in the sense that you don't have to go into an office where you have a pretty high likelihood as an injection drug user to be stigmatized. and some really uncomfortable questions that they might have to answer. And then that presents an opportunity where they might have to explain that they're looking for HIV tests because they inject drugs. So that was something that actually was brought to us from our community advisory board.
For us, it really became an addition to services when the COVID-19 pandemic hit. So our contracts through the Maine CDC to offer in-person community-based HIV testing sort of shifted, and they allowed, we had been doing like curbside testing as much as possible, but Maine winters can pose additional challenges there. So Maine CDC allowed us to use some of that funding for home test kits, and we found that even though we've been doing in-person testing for many years and have developed really trusting relationships with community members and partner agencies where we go to offer testing, we found that having HIV self-test kits really filled a gap where people weren't necessarily coming to us for testing services previously because of stigma and access and a number of different barriers that people experience. So it allowed us to obviously make testing more accessible, especially during COVID-19, and then expanded with the grant through the CDC Foundation to really sort of fold it into our regular testing services in general. And so we started expanding partnerships and really getting the test kits out there and working, making the program more culturally competent, translating materials. It's easier for folks who speak different languages to be able to access things electronically in their own language, especially when stigma can really impact even just phone interpretation services. So it's really filled a gap, and we're excited to sustain it, and just looking forward to how it can link people to care for folks that need services.
That is all great. Thank you so much. And just going on your point of stigma, how has your agencies helped reduce stigma around HIV testing, and have the at-home test kits been a benefit to the stigma reduction around that?
I guess I'll start again. We're just round robin this one. So, the stigma is a huge thing. I kind of started my organization after living with HIV for 12 years now, and talking about normalizing the conversation just around HIV and normalizing conversations around HIV in our homes and the communities that we're a part of. And so with the HIV self-test program, we found that it kind of normalized the conversation. We made it a little easier. Of course, these at-home self-test kits are an oral swab and there's no blood involved, which makes it a lot easier, and I think calms people down a little bit if they have any type of testing anxiety or anything related to needles or blood or anything like that. And so, what we found is that the access and the ease of it has just, people have enjoyed, and that has allowed them to just access it a little easier or access it more than other services that were out there. But the stigma itself has, in a way, been reduced a lot of ways because nobody is there to judge them. Nobody is there to look over their shoulder or to demonize how they live or how they enjoy pleasure. And so, with that, we give some of the power back to people, and less with the healthcare continuum.
Yeah, I love what Nathaniel said. As an organization that deals primarily with people who use and inject drugs, stigma is something that we deal with every single day in everything that we do. And I don't know about other states, but even in Florida specifically, there are even AIDS service organizations here that don't want to work with people who inject drugs, or they're really hesitant to work with people who inject drugs, which is kind of insane to me because that's one of the biggest risk factors for contracting and transmitting HIV. And so stigma is something that we really have dealt with a lot. And inherently, people who use drugs that we've worked with at least don't want to go into medical buildings and medical offices, let alone for HIV testing. And so if we can remove that barrier where they don't ever have to set foot into a medical office, they can just come to the certain service program or even get it in the mail or get it from a peer who has lived experience right there in the field with them, then that is removing a huge amount of stigma. We do not ask people why they want an HIV test. There's not a questionnaire asking you, how many sexual partners do you have? What's your sexual history? I understand why medical professionals ask that, but that's a huge barrier and can be really stigmatizing and scary for people. I have given out many HIV kits through this program, and never once do I ask them why they want it. If you're telling me you want an HIV kit, I will give you one. And so that is inherently, just by being able to offer them that and offer it, anonymously, reduces stigma right there. And then panels like this are a great way to break down the stigma, especially for people who inject drugs. Because like I said, in Florida, we don't hear a lot of talk about people who inject drugs. It's still so hush hush. So I love getting on panels like this and being like, people who inject drugs need these services too.
Yeah, I think just being able to incorporate self-test kits into different distribution sites kind of fight stigma in a number of ways, whether you're distributing, like we've worked with retail businesses that have had it on their shelves, or they'll put it in the bathroom. They'll put like a stack of tests in the bathroom for people to be able to just discreetly grab one. Partnering with different organizations that may not have like an in-person certification that's mandated by our state CDC office, but it allows them to take part and reach populations that they have special skills in reaching. And it takes the pressure off of the whole like certification piece. And certainly to both Nathaniel and Alexa's points, just normalizing testing and being able to access it in different ways. Sometimes the biggest hurdle for people is just walking through the door and committing to, like 45-minute session of asking questions, learning about PrEP and PEP, or different linkage to care services, and waiting for that test result. The self-test kit lets you be present in different events and just say, hey, take this whenever you need it, or if you may not need it, take it for a friend that might need it. We have just yesterday, someone came in for a test. And I offered a self-test kit for them to take for a friend, and that may not have wanted to access our offices. So it just sort of strengthens, I think, everyone's ability, especially when funding is always a challenge, for us to sort of be accessible to people in different ways in different places, and have a presence and be able to share education and information about U equals U and sort of cut into that conversation as well. It just lets us be in a million different places at once, and gives people an opportunity to access that in a way that's, in line with their comfort level, which I think is really important as far as taking that step to learning your status.
Absolutely. I think all of those were wonderful answers. It's just nice to hear how, stigma reduction is, a big part of, what we are doing with the HIV self-testing kits. I think it's very important that we, are breaking down those barriers to get it more talked about and make them test accessible for more clients. So just going in general with the testing program in the whole, what successes and or failures have you experienced, if any, through your HIV self-testing kit programs?
Well, one of the biggest successes is that over the last year, we've probably sent out and handed out over 700 HIV self-test kits across the country, which is a huge thing. But the downside is you can't always get them to respond and record their results, or determine when they record their results. And so the follow-up and follow-through can be, a little discouraging. But what I found in some of the surveys that we've received is that people just like the access, they like the ease. Sometimes they don't take it when they request it, they take it so that they can have it when they need it. And so we just continue to try to keep them engaged, with us as much as possible, because just outside of HIV testing, we also produce content on social media just around healthy living, ways to decrease stress, and just kind of how to navigate things in the world. And so we try to maintain engagement through that so that they still remember who we are. And we have had people come back and request more than one test. So they maybe requested a test, and then maybe 3 or 4 months later, they come back and get another test. And so that shows us that they enjoy some part of the service and what we're providing. And yeah, so it's been great from that aspect. We've had a lot of success in that. And then also with the rates of HIV being largely affecting one group more than another, specifically Black and brown folks. And then within that, Black women becoming one of the leading new demographics of those acquiring HIV in this country. Most of our test kits have been ordered by Black women. And so that's one of the huge successes. And I think that in that way, we've kind of normalized and given some of the power back to them that I think in a way that they may have felt like was taken away or never acknowledged by the healthcare system. Historically, Black women have not been treated the same. Their pain levels have not been treated the same. The way that they live have not been treated the same by the healthcare system. So having someone who has created some culturally competent messaging specifically targeting them, because Black women specifically here in Texas are at risk just by the simple fact of who they are. And so by sharing that messaging, we've been able to engage a community that historically has not necessarily wanted to come into this space because they either didn't feel like it affected them or they did not feel comfortable enough to. And so we've kind of shifted that narrative with both of those variables.
Yeah, I mean, one of our biggest successes has been peers going out into the field and giving out kits. I was running some numbers before this meeting, and we've given out a little over 1,200 kits in the last 14 months. 253 of those were through our mail-based program. So the rest were peers doing boots on the ground work. We hire people who have lived experience of drug use to go out into the fields, into encampments, into the parks, into trap houses, and find the people who are at risk who won't come to us, and we meet them where they're at and get them the services that they need. And because of that, we've been really successful at getting our results back. Obviously not 100%. That's probably never going to happen, but we do have around 19 to 20% results coming back to us because participants feel comfortable enough with the peers to take the test right then and there with them. So there's no lag. There's no hoping they come back to us telling us what the result is so we can connect them to care, connect them to PrEP, connect them to ART if they need it. The peer is right there, does the test with them, sees the results, and can link them to care right then and there. And that's been really successful. On the flip side, the mail-based program, which I believe we've spoken about before, can be very difficult to get results back. And I would say that's probably one of our biggest struggles is getting the results back from people in mail-based services. And we don't require it. There's nothing that we require people to do. If they need a service, we're going to give it to them, no strings attached. But that has been our biggest challenge, I would say. So what we try and do is we try and just give them the linkage to care for any service they might need with the kit so that they know, okay, if the kit is reactive, here's where I can go. If it's negative, this is what I can do to protect myself. To try and get ahead of that rather than hoping that they come back to us, which we know is a big barrier and they probably won't do, which is fine. And we also have trouble with the heat sensitivity of the kits. Living in Florida, really, really difficult. We've definitely lost some kits to peers, leaving them in their car. I have definitely left a couple in my car before. And there's not much we can do about that other than we have bought coolers for the peers and request that they bring the kits in coolers when they go out into the field.
Yeah, I would echo Nathaniel and Alexa. We've experienced many of the same successes and challenges that they've mentioned. I'll also say that, and this is sort of a different angle, when we started partnering with different organizations around the state to be distribution sites, it was really interesting to have those conversations. And they were obviously partners that are working with populations that we also work with. We felt strong relationships and cultural competence was there. And Sort of all of those boxes were checked, but they're not organizations that traditionally offer HIV testing services. And it was really interesting to have the conversations when we were trying to get them on board to be a distribution site. That there was some hesitation and some anxiety around offering the test. And that kind of opened up a window that we didn't realize existed. I don't know if window is the right word for that, but it gave us an opportunity to have conversations around, okay, let's back up. And why are you having this hesitation? Like, we're trying to increase access to testing. Obviously making sure that the kits were all equipped with like stickers to constantly refer back to us as far as linkage to care and being able to talk to somebody about their status. But we did have a few partners that were worried about, what if somebody tests positive? And I think that hesitation came from a good place. They cared about the community. They wanted to make sure that they could offer as much support as possible, but it was, I think, sort of a good thing to be revealed so that we could further that education with those partner providers and make sure that they had all the information that they needed to be able to support someone, but also not put too much pressure on those partners to feel like they have to do everything. So always kind of referring back to the HIV organization. I think it said a lot about stigma, and I think it, in the long run, it's made those relationships stronger. It's made the program stronger, but it was definitely a challenge in the beginning because we were like, whoa, you've been, a partner with many other things for a long time, HIV test, like we're really just trying to open this up to people. So sort of I guess a cautionary tale of like, you really gotta take every step to make sure that any partners that you work with have as much education as possible to be able to be a part of these types of programs as well.
Yes, that is awesome. I can definitely relate to, each one of you. With our at-home testing program at Caraco, I would say probably our biggest I won't call it an issue, but the biggest thing was like trying to get results back from clients. And also, just that piece of, just making sure that, inside of the test kit that the clients do have all of the information they need as far as like linkage to care is needed or access to PrEP and things like that. We wanted to make sure that those were available as well. So I do think that, those were awesome answers because I feel like in a way we all can kind of relate to all of those things as far as dealing with clients and the test kits. And so along with that, how did your organization help spread the word and bring awareness to your HIV self-testing kit program? And did it help attract the people of the community to want them to engage with you all?
So as I said, I primarily did a lot of social media before. I guess you can consider me like a content creator. And so that made it really easy for us to translate a lot of the messaging from stigma reduction to access to care and basically saying, hey, like outside of us just talking and making you laugh, we also provide this service that you can access for free. And so making it easy and like something that you can just go right from a link on our social media or my Instagram page and go right to our website has been a huge, I think, a plus. And it was really easy to get the messaging out. We also use community members and other influential people on social media. So when I first started, I kind of knew a few celebrities, like from a few of the different housewife franchises. And so what we did was we tapped them because they were part of the communities that we were looking to serve and asked them to create some messaging. A simple Instagram post just saying, hey, if you didn't know, free HIV tests are a thing and they're for you. And something as simple as that can, garner a lot of traction and a lot of visibility. And, also we've been able to partner with a lot of different organizations and we're going into the college space to provide HIV self-test as an alternative option because I think college students a lot of time get left out of the narrative when we look at data. So yeah, it's been great. And so that's kind of how we push the messaging out.
Yeah, this was something that we really struggled with in the beginning. I was actually originally hired on at the collective as the program manager for our HIV self-testing program, and we weren't really sure how to market it. Social media didn't feel right for us. We couldn't do apps like Grindr or anything like that because I didn't think that we would be able to specifically target people who use drugs. There's no like app that I know of for people, to gather around and talk about that. So we weren't really sure how to do that. We had a mail-based Narcan program, we still do, and we're really well known in the community for harm reduction services and specifically for Narcan distribution. And so at first it was we hired people who we knew were already doing work in the field, and most of them were doing it for free as volunteers. So we hired them and gave them resources and referral information and HIV self-test kits, condoms, everything, hygiene kits, all that stuff, and had them go out into the field. And so that started to work a little bit. We got, word of mouth would spread pretty quickly through encampments and things like that. But it was still a little bit difficult to get the word out past those little like chunks of groups in the different counties where we hired peers until our mail-based Narcan program took off. And it was pretty slow in the beginning, but then we started to market the mail-based Narcan more, and then we started to market our HIV tests with the mail-based Narcan program, and we would do overdose response recognition and response trainings. We would talk about our HIV kits there. We would do community events where we would do like homeless outreach events, and we would have information there. And then the big boom was when we started putting in every single one of our Narcan requests, we put a flyer in with a QR code to request an HIV self-testing kit, either through a peer that's in their area or mail-based. And it really has been exponential growth since then. We really started hounding on our mail-based HIV only a couple of months ago, and like I said, we're at 253 since then, and we've had almost 8,000 requests for Narcan in the last 14 months. So that is something that we're seriously working on, and most of our distribution is starting to pick up and go through the mail now, rather than having to stay in these little pockets where we're able to hire peers, because realistically one person can only hit so many areas, in a week. And so utilizing, which feels a little bit like cheating, but utilizing a program that we already had that was working really well, and we knew were reaching the people that we were trying to reach, which was people who use drugs or loved ones of people who use drugs, was what was really, really successful for us.
Yeah, we were able to really early on get on radio shows. We traditionally partner with a local radio station that has a really high like a very popular radio host that is really supportive of our work. And so we traditionally, once a year go on the air in the morning and do live testing, just to encourage and educate the community. With the self-test kits, it was the first time that we kind of talked about that program and the ability to be able to order from our website. And we saw a huge spike in test orders resulting from that, like live on air radio outreach, which was nice because we didn't have to spend any money on it. We followed that up with paid ads on that same radio station. We found that just for the orders that spiked after that live testing on the air, 50% of the individuals ordering from us reported that they had never been tested for HIV before. In addition to, some other risk factors that we were able to kind of evaluate that data. And it was interesting to see the populations we were able to reach through that. So leveraging those types of relationships for those influencers or people who are, reaching the broad community, we're often kind of like preaching to the choir with, all of our outreach depends, as far as social media is concerned, kind of depends on people paying attention to us in the first place. So being able to have those platforms that have just a huge reach was really beneficial to us. We also made sure that with our printed materials, when we started working with community partners to distribute the tests, that we asked for those partners to hang up posters that had a QR code to order the self-test kits. So the posters would kind of say like test kits available here, or you can order it online with the QR code. We asked those partners to hang we made a specific ask to hang it publicly and then to hang the same poster in a private space so that people were likely to see it. But if they didn't want to be seen scanning the QR code, there was like another spot to do it a little more discreetly. Just trying to be sensitive to that as well. And that was really, I think, what having the partners and also the radio advertising helped us out a lot.
Okay. And I know that we have touched a little bit through the questions on like targeted populations for the at-home test kits. So just to hone in on that a little bit more, did your organization have a targeted population you were trying to reach with these? And if so, was there a certain area where these people were that worked a little better? So whether that be like a rural area, urban, or suburban area, that you notice may have worked a little bit better in getting those tests distributed than others?
Yeah, we did target it. I mean, but we targeted anyone who had decreased access to care. So that included anyone who was historically disenfranchised or who may have may live in a rural area and not have a clinic that's easily accessible, or may live in a situation to where getting tested at a traditional clinic just is not a viable option. And so those groups included, people who live in rural areas, Black and brown men who have sex with men, Black trans women, Black cis women, and I mean, those have been our biggest consumers. And it's actually we open it to everyone, but that is who we targeted because we know that they have, in a lot of ways, decreased access to care, and so to kind of bridge that gap, we wanted to make sure that they were a priority in how we marketed and how we chose our influencers to provide messaging around the program.
Yeah, I mean, I think it's pretty clear by now that we target people who use drugs, people who inject drugs, and unhoused people. There really was no location necessarily that worked better for us. Like I said, we had peers that we hired throughout the state, and we do a mail-based program. But we were targeting specifically people who use drugs and inject drugs. And to be clear, people who inject drugs that share syringes, because that's the risk, is the sharing of the syringes, not necessarily the injection drug use itself. So we're housed here in the syringe exchange in St. Petersburg in Pinellas County, and so while they're waiting to get their HIV testing up and running, we give out HIV self-tests. But I haven't noticed much comparative success in one location to another. I will say, like Nathaniel said, I'll give an HIV kit to anybody who wants one, the self-test kit to anybody who wants one. If we often have people, we are in an area with the syringe exchange that's historically BIPOC, historically really low income, and we often have people walk in that just want water or a hygiene kit, and we've had people ask for an HIV self-test kit, and I'm not going to say, well, do you inject drugs? Are you men who have sex with men? I don't care. I will give you an HIV self-test kit, no questions asked, if you want one. But yeah, to answer your question, yes, we targeted people, obviously, but just by all my answers. But we didn't really notice a big difference between geographic locations.
We found that the highest rate of in-person handoff and distribution was with syringe service programs, as well as some agencies that are like family planning clinics, but do a lot of outreach to populations that are unhoused through just their mobile health outreach. So we've seen a high rate of distribution to that population, those populations as well. We've started to just now see an increase in distribution. We partner with, it's called Maine Access Immigrant Network. It's a organization led by primarily refugees and asylum seekers, and it's sort of a collective of community health workers. And there's a great deal of stigma within that population. And so it took a really long time to sort of see an increase in distribution. We noticed a lot of education happening and then an increase in the number of condoms distributed at the site. And then finally, that was followed by self-test kits that we're now seeing an increase in distribution. So with some sites and populations, it it can go slower, but it's sort of nice to see that progress and know that regardless of the time frame, it's still reaching people that need the service.
I also want to say, I forgot to mention, we do target sex workers also. We have a couple of peers who walk sex worker strolls and things like that. And it's really interesting. I don't really have any specific data to back this up, but there was an anecdotal thing that was brought up that showed we had one peer who would do sex worker strolls in 2 different locations. One had primarily cisgendered white women, one had primarily women that were people of color, and a couple, non-binary and trans women. And the cisgendered white women were really, really wanting HIV self-testing kits, and the people of color just were really, really hesitant. And I think that might be a cultural thing. In Florida, it is difficult to be anything that's not straight, cisgendered, and white. But that was just something I wanted to bring up because it's really was a little perplexing to me, just because I'm a very numbers focused person, and there was no rhyme or reason that we could see, and that was not mirrored. Up in Duval County, we had peers, and they didn't have the same experiences down here in Pinellas and Hillsborough counties.
Yeah, I think that is a great point that you made. I can honestly say here in Ohio, we do have that same issue with, people, not probably feeling comfortable enough to, utilize services such as these, just because based on their, skin color, or, just the barriers that they have in their life. It does add a extra layer of, stigmatization that we do have to break through with them as well. But Alexa, I want to kind of, because I'm curious, because I know that you've mentioned that you also had a mail-in order process for your at-home testing program. And if you two also have one, please feel free to chime in. But I do know that at Caraco, we also did the mail-in order for our at-home test kits as well, as the option of giving them out in person. But I'm just curious to know, did you see, in either way, whether it was in person or mail-in order, did one of those kind of trump the other as far as getting them out to the community? So were there more people, mailing in orders to get them sent to them, or did you have more successes as giving them out in person through outreach and things like that?
Yeah, I mean, my answer is purely guessing, because I don't really have much data to back it up, especially because our peer in-person distribution started way earlier than our mail-based did, and so it's difficult to compare the numbers. I think there's pros and cons to each. I think that there are certain people that will order in the mail because they either don't have access to a peer, because we only have a couple peers, and Florida's a pretty big state. And so they either don't have access to a peer, or they don't want to talk to somebody, which I totally understand, or they live in an area that's not close to a certain service program. As big as Florida is, we only have 6 legal certain service programs. And like I said, the people that we're targeting, people who use and inject drugs, there are, not all of them, but there are a lot of organizations that are for HIV, or their AIDS service organizations, that are really stigmatizing and will come out and say in meetings that they don't feel comfortable working with people who use drugs. And so I think our mail-based program is strong because of that. But I will say that the peers who are out in the field have built such strong rapport with the participants that they are very successful at giving out kits when they have them. And that word of mouth of, Joe getting a kit from one of our peers and then going to his friends and saying, hey, that peer was really great, non-stigmatizing, didn't give me shit for, using drugs or whatever. That has been really, really, really successful. That trust and rapport has been by far the most important thing that we have, and more important than the anonymity of it. More important course I just got logged out. Okay, can you guys see me? Sorry, somebody logged into our account and it kicked me out. But yeah, the peer has been really, really successful when they have kits to give out. That is, and the word of mouth and the secondary distribution, which I think Katie brought up, of people coming in and saying, "Can I have 5 kits? I've got friends that don't want to come to you yet." And we're like, "Sure, take as many as you want," you know? So no, I don't think that one is necessarily stronger than the other. I think they both have pros and cons, but I do think that rapport goes a long, long way between the peer and the participant.
Yeah, I would second all of that. Our testing program was primarily mail-based, just by creating reels and letting people know it was an option. And so that worked really well for us. And then, once it got warmer, we got out into the community and realized that people still wanted HIV tests like on hand as well. And so we found that there were 2 different groups. There were multiple groups and multiple different desires in terms of how people wanted to access testing. By mail-based, sometimes I would create a post and go to sleep, and in the morning we would have maybe 40 or 50 orders. Similarly, sometimes we will go to an event, and we would run out of all the test kits that we had with people who were leaving and us handing them out. So it really just kind of spanned across the spectrum in terms of which one was better. They're both good. I think they're both needed. Our mail-based system definitely gave people the option to not necessarily have to be at an event or be anywhere else to receive the test and go ahead and order it, which has been a great tool. But then for those who are right there on site who may not use social media much or may not necessarily run across one of our ads or one of our peer supporters, they then have the option to take it with them. So even with that though, we found like, some people wouldn't want to walk around with the test kit if they did get it at an event or something like that. So we would still give them the option to either maybe put it in a bag or a discreet box, or to just request it on site and then have it mailed to them. So it was there, within about 48 hours to their house. So both have been good, but I would say probably 75% is mail-based. That 25% has been handoffs.
Yeah, I'm glad you asked that question because it made me pull up the spreadsheet. I didn't know it off the top of my head, so thank you. We've distributed about 1,100 self-test kits, and about 20% of those have been mail ordered. So the bulk is happening with partner providers. And again, a mix of like community-based medical FQHCs, but then like outreach organizations, retail, number of different venues.
Great. That is awesome. Yeah, I really would say through us, I believe that, we did have a really good successful at-home testing program. I would say that our numbers probably came 70-30. 70% of it probably came from the mail-in orders that we had, because we did like a lot of advertising and like billboards around our area and bus shelters, and so we had a lot of mail-in orders for ours, but also our syringe exchange program and just doing general outreach made up the 30% probably of the at-home test kits we distributed. And we also were able to just reach a lot of clients, whether they had a mail-in order or in person, and that was probably the most important part of it all. So that's why I was just curious to just get a little bit more insight of how your mail-in process worked and everything. So that is great. So just to tie everything all together, just one last 2-part question. How has the use of the HIV at-home test kits helped with HIV testing in your area? And if you could just share one success story from your at-home testing program that sticks out to you the most, that would be wonderful.
I'm sorry, I really got the second part of that question, and the first one just literally went out of my head. What was the first part again?
Yeah. It's just, how has the use of HIV at-home test kits just helped in general with HIV testing in your area?
Oh, okay, well, yeah, we opened our HIV self-test program nationally. Once we realized that we could actually do that, it was a great tool. I've lived in 6 different cities, Dallas being the sixth one. And so it's always been difficult for me to find a clinic, a consistent clinic, or find one that I was comfortable with, that I would actually utilize. So this has been a great tool and a great option for people who move and travel a lot. And we found that it is something that they want more of. We're in the process of trying to figure out ways that we can expand our testing profile beyond HIV, because that is not the only thing that our communities deal with. They deal with other issues and other areas of harm and risk that we would like to address and make more accessible to them. So it's been a great program. It's been greatly received, and what the feedback that we have gotten, and I want to make sure that I reiterate that, because these are not my words, is that they appreciate that there's another option. They appreciate that there's an option that directly gives them their power back, and with that is one of the specific words that was used, that they felt empowered to be able to take care of themselves with this option. And so that's been one of the biggest successes, and also increasing the levels of trust that the community has around the fact that we actually do care, and that we actually do want to provide a sustainable service, and one that is culturally competent, and one that they actually need. And even though I live in Dallas now, I'm actually from Dayton, Ohio. That's where I was born at. And so I understand the culture and the shift in between how we have a huge distrust of the medical system in Black and Brown communities historically. And even with going a little step further, to your point, Alexa, like the drug and the opioid epidemic really demonized, and it really trivialized the issues of a lot of people who do use drugs in different ways around the country. And so I think that this option has allowed these people to realize that we still care about you no matter how you live. And so that has allowed people, I think, to be able to see themselves differently, because we're not judging you. It's like a judgment-free zone, which I think allows a safe space for a lot of people.
Yeah.
I think
Go ahead, Katie.
I actually wanted to just take a minute and say to Alexa, and for everybody, I'm really sorry to hear that the population you're working with is experiencing that with HIV organizations. And I think we should all step back and say that any organization that is discriminating against a specific population has no business calling themselves an HIV organization. HIV impacts all of us. Everybody should feel comfortable and be empowered to access services regardless of what a specific risk factor is. And so I'm really sorry that the population you're working with is struggling with that. And I'm so grateful to you for being in the space and being committed and dedicated to sort of help people navigate that challenge, because that is, I cannot imagine how frustrating that is. And I certainly hope those organizations aren't getting federal funds, because I would maybe tap HRSA on that. So I'll just say that. And to answer the question too, when we applied for the CDC Foundation grant, we traditionally pre-COVID were performing about 500 in-person HIV tests. So we budgeted for, the distribution of maybe 400 self-test kits. We thought that was like expectations, and we were able to distribute with the initial 12-month grant period, we distributed about 900 test kits. So it's essentially like tripled our capacity. I feel like it's really just completely changed the way we're able to reach individuals who need testing services, and it's changed our messaging. It's obviously impacted our ability to fight stigma in many ways. And I think one of the things that I'm really hopeful for in the future, and I don't know if this is going to come up in another question, but we need OraSure to make the package smaller. COVID tests are, and now thankfully, I think I was really nervous in the beginning because HIV testing can be a really nerve-wracking process. I was nervous that people were going to see the control line and their mind would immediately go to that being reactive. And with the onset of COVID tests and people working through, I think I'm more confident with everyone saying, okay, hold on, this is a control line. I got to wait another 20 minutes. So now that like self-testing in general is just different and more accessible, now we need OraSure to make the packaging smaller. They make tests that are distributed in other countries that come in smaller packaging. It would make our jobs easier. It would be more cost effective from a mail standpoint. I know probably no one from OraSure, I'm not trying to like go on my, so, you know, well, I'm sure you're all in agreement with me, but I just want to say that out loud. So
Katie, there's power in numbers. I'm going to tell them the same thing.
okay.
I will also tell them that. Yeah.
Yeah, that's my next goal.
Jamar, can you repeat the question? Katie saying that she hopes that they're not getting federal funding really put my mind somewhere else. I'm Katie, for your sake, I'm not going to tell you how much federal funding they get.
Not a problem. How has the use of HIV at-home test kits helped with HIV testing in your area? And if you just have like a success story from like, you know, the program and like to share.
Yeah, I mean, I think we between the three of us, we really covered it. And like I said, this was something that it was such a high need that the community came to us and told us we want at-home HIV self-testing kits. And so we wrote a grant. We got the grant with the CDC Foundation and have been, you know, we got not refunded, and then we had to give it back, but we got funded again to continue that program. And it's really busting down barriers for people who inject drugs. Because like I said, and it's not, I just want to clarify, it's not all HIV service organizations or AIDS service organizations, but unfortunately, especially in Florida, especially with the stigma that inherently comes with injection drug use, it is a steep uphill battle here. And I do want to say that I think the biggest success that I personally feel like that has come from this program, other than the obvious, right? We're getting people tested, we're getting people to know their status, we're getting people connected to care, people who are not traditionally coming into medical arenas. I mean, we have people here, as a side tangent, we have people come into the syringe exchange that have severe wounds from xylazine that won't go to the hospital. So let alone to get tested for HIV. So I think what is most heartwarming to me is a lot of people, when we ask them why they want to get an HIV self-test, whether that's in mail-based or in the field, a lot of them are just saying, I just want to know. It's part, you know, I want to take care of myself. I want to know what my status is. It's time. I need to know it. I have risk factors. And that stands so starkly against what the general public thinks about people who inject drugs, especially unhoused people who inject drugs, that they don't care about themselves. They don't care about their health. They're not taking care of themselves. And when they're answering like, I want to know, like, I need to know my status. If I have this, I want to know so I can take medicine and I can take care of myself. I love having that in numbers. So I can say, well, actually, they do care about themselves. They want to get tested for COVID. Some of them want to get vaccinated for COVID. They want a hygiene kit. They want clean socks. They want to get tested for HIV. You know, they want sterile syringes. I mean, the syringe exchange has only been open since February, and we have almost 80 participants enrolled. We've given out thousands of syringes. So having that interaction with them and talking to them about why they want to get it, I love having data to back it up when somebody says something so ignorant about people who use drugs. And I can say, well, actually, you're wrong. This is what they've been saying. This is why they want it. And I love seeing the face that they make when I say that. So it selfishly brings me joy.
Thank you all for those. I think those were wonderful answers. And just one other thing I would like to point out, just to answer the question myself. I think that the use of the HIV test kits have been useful because of how easy they are to use. I think that the fact that clients are able to do these in the privacy of their own home and still have the resources for, you know, whatever they may need after the fact is very important. I think that, you know, because these are quick and rapid tests, they only take about 15 to 20 minutes for your result to come back. I think that, that kind of helps with the anxiety of it all as well. Because I remember long ago, like getting HIV tested, you would have to wait days, maybe even weeks for results to come back. So I do think that the fact that they are quick and easy to use, they give you rapid results, and it's just a mouth swab instead of like, having to use a needle or to see the blood. It is very accessible for them, and it makes people want to use them a lot more because of the access and the accessibility it is to for the kit itself. So yeah, I honestly think that this was a wonderful conversation. I want to thank each and every one of you for participating in this panel with me, and I'm just enamored by the work that you all have been doing with these test kits, and I just wish you future success in all of the endeavors that you all have. So thank you so much for joining me here on this conversation today. It's really been great.
Thanks,
Yes,
Jamar.
thank you so much, Nathaniel, Katie, Alexa, and Jamar. This has been such a wonderful, informative, lovely panel, and we were so glad that you spent this hour with us. So thank you.